Hi, it's Dr. Noel Robert Williams, Oklahoma City, Oklahoma, Optimal Health Associates, April 21st, 2020, COVID update. So let's do statistics first. About 2.02 million cases in the world, a little over 800,000 cases in the United States, a little over, almost about 2,800 cases or a little more in Oklahoma, in the state of Oklahoma. Deaths, about 180,000, a little shy on the world, about 43, 44, depending on which data you're reading in the United States, and 164 in Oklahoma, a bigger jump in Oklahoma the last day. Again, the statistics are hard to, or looking at all the numbers are there's a lot of noise in them because the testing's so messed up and data reporting so messed up. But the bottom line is, COVID's still growing. It's going to continue to grow. And we're going to go over why it's going to continue to grow tonight. Then some solutions for that are ideas on what we can do that are more reasonable, perhaps, for society in general. Want to talk a little bit about testing. I think that there's this big misperception about antibody testing. I want to directly address it. Don't do it. It's a waste of money. I texted someone tonight. It's a great way to separate a fool from their money. The testing is meaningless. I talked to the head of infectious disease, David Chansomer. I texted him, one of the senior VPs at Integris. I've talked to our lab people. The antibody testing is not meaningful. There's several reasons why it is not meaningful. The first thing is, just because the FDA approves something doesn't make it meaningful. Think of all the things they've messed up, including this entire thing. So the last thing on earth they're going to do is say no to Abbott Labs saying they have an antibody test that hasn't been validated by anyone. Okay? So keep in mind, there's a bunch of coronaviruses. The whole screw up with the CDC was they tried to make their initial swab test in the nose for all of the coronaviruses, and when they rolled it out, it couldn't detect anything accurately. So it recalled, it blew the whole thing, and it was a disaster. So now let's reverse that to antibody testing. If you get an infection, you can make an antibody to it, or you're going to make an antibody to it. First, it takes a month to make IgG antibodies. I'm not going to go into the details of that, but that's a specific type of antibody that shows you've had an immune response long-term to an infection. So the issue is, there's coronaviruses that have been in the environment for forever, since the 60s. There's SARS and MERS, which are not in the environment really, but the other four are. And so when you do antibody testing, there's cross-reactivity. And you have to have a pretty specialized antibody test first to be able to distinguish between COVID and the other ones. And most of them are not going to be able to do that. Number two, we have no idea what level of antibody titer, how much of the immunoglobulin that needs to be produced to give you immunity, and this is the big ticket item. There's papers out showing there's a variety of COVID-19 viruses. There was a Chinese paper out today that showed that there were more than 30 different antigenetic variants, and the antigenicity, or how much protein or the molecules on the viral protein, how those are varying much more than we ever thought. Once again, thank you, China, for not telling us, but thank you to the university there that did do this. Not a peer-reviewed journal, but they found 30 different variants of the COVID-19 virus in their province. And this is the scary part, but we're going to address the scary part, so don't worry. Of those different viruses, they had wide variance, not only in what they looked or were under with the genetics. Their infectivity was different, and the amount of viral production that happened in cells was different. Some of the more stronger variants produced 27,000 more viral particles than the weaker variants. The stronger variants also were more lethal to human cells. So let's start thinking about that. So we have some people who get the virus, they don't get much illness. We have other people who literally get sick like that and die. So we're starting to get an idea a little bit more about this. There's been 2 case reports in the United States, one from a poker game, and I forgot if it was 10 or 12 people were playing poker. 4 of them died, and all of them got infected, and a few others got sick. There's a family report, I think, out of Georgia. 9 family members got it. 3 of them died. obviously a much higher percentage of people died in these groups, and most of them got sick. Probably a stronger variant in terms of how intense the virus was. So even if you had a COVID positive antibody for whichever one that company has picked, it is meaningless across the other ones that could get you sick. So you don't even need to bother to do it at this point. It is a waste of time. There's no scientific validity, so don't do it. But if you want to do it, you can. You're just wasting your money. And it doesn't give you any protection. There's no data to support that. And there's actually more and more data saying, oh my goodness, this has mutated massively already, and there's not going to be immunity. And probably from the same kind of thought process, the thought of doing vaccines is not going to be helpful. And probably doing antibody injections, which I've talked about, probably aren't going to be helpful. And so what can we do? Because we can't keep the country closed for the next 5 years or 3 years or 2 years, or the world. So let's get back to who's getting sick. The people getting sick predominantly are people in nursing homes, people who are older, people in urban environments. So the uniform theory to all of them in terms of why they'd be at greater risk, if you just boil it down to a simple concept, is they're nutritionally depleted. Nutritional depletion, not having enough of your core vitamins to make your immune system work, puts you at risk for illness. And so, since we have this terrible virus, we need to have our immune systems working now more than ever, and that's going to be the main solution, along with proper hygiene all the time and masks, to an extent social distancing. But I think ultimately it's nutrition. You need to be on a super strong multivitamin. You need to be on a super good dose of zinc, 50 milligrams usually a day, 25 to 50 for adults. But 50 is what I recommend, kids 15. I've already gone over this a bunch and we have a separate post on it. Just keep that in mind. I think there's a lot of meaning for vitamin D. There's some data on vitamin C. I just can't make that a huge part of anything other than to say that, yes, in a multivitamin, there's a good amount of vitamin C and that's going to be adequate. And then there's probably a role for iodine also. But those are your core things. And then you want to add melatonin to interrupt the inflammatory cascade. If everybody does that, it's going to have a huge impact on the disease event. And I think that's what we have to know. And all this other stuff, vaccines, antibodies, it's just going to be like the flu where it's mutating all the time. I don't think that's going to be the solution. There is some good news, though, in terms of a medication besides Plaquenil. I think in the end, some of these high-intensity antivirals are going to work, because from talking again to some of my very smart doctor friends, and this one was Bill Bondurant, talking about RNA transcriptase, which is what takes RNA in the virus into products and other things, gets interrupted by these antivirals. And this is an RNA viral protein like most of the ones we deal with. And so some of these meds are going to work really well if they're started reasonably early, likewise with the Plaquenil. But the other thing, some of these viral medicines might work later also in the course of someone sick, and then we still have some rheumatological drugs on the horizon that are going to have a big impact for those people who get sick. But looking at the antigenicity and this variation and stuff, I don't think that's going to be a great plan to do a vaccine for this. It'll be about as meaningful as the flu vaccine, which I don't think is meaningful at all. There are meaningful vaccines, but there's also meaningless vaccines, so we have to always remember that. The other thing, just in case people continue to say, oh, we shut the country for 42,000 deaths. Really? Let's look at Italy. Italy had 100 doctors so far die in a month and a half from being exposed with all their PPE. Those people died because this is a vicious, vicious virus, okay? Tell that to the 30 police officers in New York who've died this month. The virus is deadly. Slowing the economy down, while very painful and horrible, was the right thing to do. If you think 40,000 people would have died only, then you've ignored all the data. The whole reason it's only 40 right now, and while it's probably going to get to 60 or 80, maybe even 100, is because we've slowed the country down, which will give us time to manage what's going to come. And I agree that there's been some misinformation, because I think we all thought there'd be overflow at the hospital. We didn't realize that once people go on a ventilator, they're probably going to die. So the length of time on ventilators was not as foreseen. But ultimately, 40,000 people in a month, or 43,000 people in a month in the United States dying, that's more than it takes. The worst year of flu in the last 20 or 25 years was, I think, 18, 19, or maybe 17, 18. It was about 40,000 or 60,000 people. That was the worst flu year ever. Last year or the year before, it was like, it averages about 18. Car accidents is 38,000 people in a year. This virus killed 40,000 Americans in a month. 30 police officers in New York, other police officers in other places, 100 doctors, and countless healthcare workers in Europe. I mean, again, 10% of the deaths in Spain in a month were healthcare workers. So imagine if that virus was being transmitted everywhere by people who were running around. There would have been a lot more deaths. So be that as it may, we do need to open up the country. I totally agree with that. Economically, we can't keep it closed. My only argument about all of this would, of course, be that if we would have done it in a sane, measured way in early February or mid-February or later February or the first week of March, and really closed the country down, it would have had a huge impact. We would have done it for 3 weeks to 4, we'd be done. But that's okay. So the summary is, it's going to be about nutrition. It's not going to be about medications. It's not going to be about vaccines. It's not going to be about antibodies. It's going to be about being nutritionally depleted, so you're going to have better immunity. And then there'll be a few medicines like Plaquenil and some of these antivirals that will be appropriate. But that's going to be the focus for the next 3 years for success. It isn't going to be, we're going to pull a rabbit out of the hat and there's going to be a vaccine, because there's too much variation in the virus. And so you're going to hear more and more about that as the science comes out. Because remember, we've only had really 3 months to work on this total. So anyway, have a good night. I'll update you tomorrow. Take care.